really encouraged about the changes I've been seeing. And we've been working closely with Regina and making some associations and collaboration on efforts on immunizations and other areas, but I have never been more encouraged than I have in the 17 years. And then along comes Cindy, and the first thing she does is come into my office and raise havoc, you know.
No, we were joyous. We were going there. No, I'm so happy.
It's very encouraging, and I want you all to know that what I see by these two grants, and you guys might not see it as a blessing to this community and an opportunity to do some really good things. So please, I know how it works here. Word of mouth is your best tool of advertisement. Get the word out, people, and let them know. We cannot afford to lose this hospital or clinic. It will be devastating to our community. It just will. So get the word out and let them know that good things are happening there. I see it.
I've heard this before, we hope.
No, I'm
From one of the hospital district board members.
And I think there was a question down there, or a hand. Did you, anyone have it? Okay, right here.
I have lost, well, the clinic has lost records of mine that they've never been able to locate
Great.
again.
When did that happen?
Well, it was 2 years ago, December,
okay.
and they lost a whole, like, years, not the whole file, but like the last year's file, a chunk of it, that I keep going back and asking, did you find it? And I found it. And then it's still with me with billing, and because I've had numerous.
Would you make sure the billing issues down there, and I don't know if I can do anything with records that are 2 years past being lost. And I, again, apologize for the sins of the forerunners here. That would just be very discouraging.
They don't keep, I never understood, how can you just lose
They
something
can't-
like
oh,
that?
Well, trust me, I've worked in paper charts for many, many years. And if you worked in paper charts, you'd go, how in God's name do we keep them? I mean, it's just such a wreck. No matter if you have the best medical records to keep on face here. Now, of course, as we change to electronic, there's problems on that side too, but the whole reason is not to lose them, right? So, but it would be devastating to lose historical medical records. Maybe if in the next year we redesign the clinic again, we might find them, but don't want to hold out any hope there. That's
So
pretty
then
long time.
also, meetings, you said you had the transportation, is that a daytime meeting?
It's 9 o'clock Tuesday, the 26th, at where?
County Commissioner's Office. It's right before the Pioneer Council, our monthly meeting. But
It's at what time?
9 o'clock,
Oh,
next
9.
Tuesday.
Monty,
in the
will you
morning.
email
In the
Peggy on
morning.
that?
Would you please?
Yeah, you bet, Peggy.
Yeah.
And I have to excuse myself, I have a training meeting tonight too.
Thanks, John.
Any other, I thought there was another question. Maybe I just saw your hand going up. Thanks,
Yeah, I'll make a quick comment that whole concept of patient assistance programs. What it looked like 10 years ago is very different from the last year or the last 6 months. We have, I'm a provider in other contexts, and I used to count on the cheaper cost of generics in order to save people from the donut hole on their Part D Medicare. I'm now shocked with how quickly people are getting to that donut hole. And some pharmacies in the state aren't tracking it, and the patients that don't have a copay for a long time don't realize it until they get the sticker shock.
Yeah.
And so an example would be a tricyclic antidepressant that was $41 a month for a person is now $750 a month. And there were 6 manufacturers of this medicine. It's a very old medicine, over 30 years old, and now there's only 3 in the country. And so we are having some, it's a free-for-all in terms of where the costs are going to be for this medicine. So yes, there are still good patient assistance programs out there, and you can do it on a shoestring, even if you don't have a $200,000 grant. But it's still going to be a very dangerous time, I think, for our county. I consider it almost a public health crisis.
Right, when people who need to be stable can't get their medications,
Right.
it's a huge issue.
And I hope that we consider, well, I'd like to support considering that so that we have a safety plan for them.
And I'm more than happy if you guys want us, I'm looking at you, Faith, if we want to form a community committee on that. I know Regina would sit on that.
And I'll volunteer time.
So, would you tell me your name?
Desidy Clark.
Oh, you're Richard's wife.
Yeah.
Oh, well, lovely. If you can,
And I'm a
Connect.
nurse practitioner, so.
right, if you can connect and then we can get something going, and that would be lovely.
Did any of you participate in Natalie Claiborne's Community Health Services Development Project, for a community health plan? It was specifically for the hospital, just this last summer. Kirsten, you were involved.
None of these
with that.
people were on the board, but you may have gotten the survey.
The
Okay.
survey was sent out in March,
And-
wasn't it?
Right, yeah,
So
spring
many-
sometime.
That's the one that's posted on the hospital, but it said that there was there was a significant number sent out in the community. No one here got that survey? Oh, you did? I mean, we're just
I
curious,
got it.
not everybody gets
Yeah.
it, there was only about 400 surveys, they do it.
That identified a lot of these issues. I don't recall the patient medication one.
Mental health was on it. but they
Yeah,
didn't talk
yeah,
about
certainly.
it. Yeah.
certainly.
Yeah.
Sure.
Another issue that I personally had, and Regina solved here a month or so ago, or 2 months ago, people here in the county have been spoiled because we will call the pharmacy in the morning at 9 o'clock and give them a prescription and expect to go in there at 4 in the afternoon and have it ready. All of a sudden that stopped. An expired prescription, but all of a sudden that stopped. And I have a friend just today told me it's been 4 or 5 days and he finally got it refilled today. He was a diabetic, but I don't know what's happening there, but it's causing Kurt at the pharmacy a lot of problems.
Oh, the orders, you're talking about the orders.
Yes, and getting the prescription approved and back in a reasonable amount of time. Because there's not too much profit in it for Kurt.
There's none for a small pharmacy, I used to run 2 of them,
Yeah,
there's none.
and he's, calling 2 or 3 times to get it refilled and so forth and so on.
So just so you know where we are with that, when you go to an electronic record, e-prescribing is supposed to take care of that, make that all better. In real life, what happens is it just bottlenecks in an invisible universe, right? Okay. So what we haven't done a good job at the clinic yet, but we talk about it, is we need to say, please help us, we'll help you. We need you to notify us 3 days in advance of when your script's going out, unless it's an emergency, sometimes you don't know that. But we need to put, and that's standard in almost every clinic in the country.
Hey, people here are spoiled.
Right. Well,
Yeah.
I mean,
Yeah.
trust me, I owned a pharmacy, so I wouldn't follow the rules some days, and they go, oh, she's the boss, I better, I try not to do that. But we need to put those kind of standards in place so that the pharmacist has some leeway. It gives us a buffer, and that we don't strand people without their critical meds for stabilization, especially diabetes. I'm
Yes.
quite frightened by that. So this is a project, Regina, we took on week 1.
Yeah.
Okay? We're not solving it yet. Remember, it's a problem at every single clinic in the world. Ours, the good news is, it's so bad that we're going to make progress leaps and bounds. But we will make progress, and it is a critical, right? I'm not going to go unless you fill my prescription when I need it. I just am not. I wouldn't go to this clinic unless they take care of me like that, right? I can go to Missoula. I can go to Spokane. I happen to have a car that works. We get it. We really get this. And we're going to change that. It's going to take a few weeks to improve it, but we're going to change it. It's critical.
We currently have a committee put in place, just in regards to refills, because it was a great problem that needed to be tackled and
You
fixed.
hopped right on it
Right away.
That was 2 months ago.
Yeah. Right, and I mean, but we just developed the committee in regards to, and part of, process and changes is finding out what your current state is. And that's the process that we're in right now. We'll begin to convene and meet and make protocols and, get this running a little bit smoothly. Another thing to be said about electronic health records is we can hit the button and send it, and if it's not working on the other end, and we don't know it's not working, we don't know, because unless, it sends us back that it failed. But if something's failing on the other end, it shows us on our end, it went,
Went through,
but he never got it.
yeah.
So, you know, the one system we put in place with Kurt is, Kurt, if you have a patient come in and they said, we sent our prescription and it's been this amount of time, please give the clinic a call while they're there so we can rectify it, because something's not working on one end or the other. And that's part of what happens with an electronic
Yeah.
system,
Yeah.
which is out of everybody's control. It goes off into universal world of nobody knows what the problem is.
The
So
cloud.
the cloud.
And we do want to announce, Kirsten, that soon the hospital will be going to the magic electronic record, so be prepared.
December 2nd.
Yeah, so, as all, you know, there's no magic to it.
We brought some benefit to the economy today, I think, of Superior.
Yes, lots of people here
There
today.
are lots of people here today.
Training. Other questions or concerns?
I don't have a concern, but I was interested when you said that you needed more assisted living. The original plans were to have another unit across the road.
Oh,
And-
cool.
And that was in the preliminary planning, but of course finances kind of staggered that.
It's almost full. Let's see, it has a, 12-bed capacity, really.
It filled quickly.
Right, and you know, if you have, but I think the license is at 15-bed, I think that's right. And it's set up so that you could admit couples in 3 of those
There were
rooms.
3 double rooms.
Cliff told me that they hadn't had,
Choose the pass that you go to the hospital.
what's that?
Choose the pass that you go to the hospital.
Oh,
Or just so you know.
And I think you
context.
It
know
was
her.
built under my watch,
Yeah.
with a lot of trouble.
well, I saw the name over here a little while, Madeline Falls.
Oh, I didn't know if you knew.
I
Okay.
assumed that, well, I didn't know which one of you was
You're right.
Madeline.
Well, how many of you knew that it caught fire and burned half down before we got it?
Oh, really?
Yes.
Yeah, I mean, I don't know that at all.
An old man had a stroke out on the highway and his car ran through the fence
Oh, clear, correct.
and into the
Wow.
entrance. The building was, well, it wasn't finished yet, but, and the old car hung up on the cement block that the railing things were on and caught fire.
Wow.
And I got this call about 6 o'clock in the morning, their assisted living is on fire. Oh my God.
What next?
Fortunately, I had the insurance, and it was all in place, but that assisted living was a struggle. It filled rather rapidly, and it's been a success, I think, ever since, except the heating.
I left Malta 6 years ago, and at that point, we had, I don't know, 8, 12 beds of assisted and 8 independent, and about a 54-bed nursing home, and it was all part of the old nursing home, you know. Since I've left, they built about a 20-bed, I think, I don't know, 18, 20 beds, I'm not sure. It's got a wonderful fireplace in the middle of it. It's a real, and it filled instantly. They built that about 2 years ago, and it's like double the size of what it was. And it's a great transition place, you know.
We had 3 people that moved in the first day.
Madeline, I appreciate you coming to
Right.
this, it's really good. And Lloyd is chairing one of our subcommittees on the board, and we will be recruiting. Our board gets appointed, it's not elected. And so there are very good folks in here, and if you have any interest in being a board member on the clinic board, and your job allows you and all those kinds of things, please let myself know. I'll get that information to the committee on our board as well. We have about, I think at the moment, we have 2 openings. And we're always looking for people who use our services. The board of the Community Health Center is a very specific board composition. You must have at least 51% users of your care. And it's one of the, I've served on a lot of boards. It's a very unique board to work with, as is a publicly elected board from the hospital that Larry works with. But, so I'm just encouraging folks, this is kind of a little given Lloyd's talk, recruitment, see what we can get. If you have any interest, you would be, you commit to really understanding and participating at least 2 hours a month at different meetings and really bringing forth the community's concerns. And your own brains to this process, so.
And really, the best thing, we've been consistent, I've met with all of the employee groups, 3 different sessions, met with the county commissioners a couple of times, Cindy has too, our own internal supervisors and the board, of course, and our message has been consistent with all of those sessions is, the biggest way, we have the question come up every time, what can we do to help you? It's to use our services. I mean, and it's hard when you have some trust issues, but in order to move forward and make sure we do have a hospital and a clinic, down the road, it's just really important that we have a few more residents on the assisted side, a few more residents on the long-term care side, and better use of our outpatient services and clinic services, our primary care services. It's just critical right now that we have that.
You might want to put that on your website, because when you go on your hospital website, the stuff is really dated, and in this technological universe we live in, people are using that kind of access more and more. And
just so you know, Jim, we will put that on the list, and because we are deep into the weeds right now, that might not get fixed right away. I don't want to set your expectation. I'm totally with you. We got to get our plan out first in the next month, and then all of that will reflect that, we hope. But we're with you on that. I wish I was like a tweeter and all that stuff.
Yeah.
Not quite there. Go ahead.
I was thinking
Thanks,
about,
Phil.
if people are ginger about, jumping into the water and using the services, I'm thinking about, school starting, sports physicals, and I'm thinking about summer camp getting ready. And then there's a few other sign-offs. There's things related to the winter season.
Right.
And if you could promote some service utilization in those kinds of discrete areas, you get some put-through of people, and you get some money, and you get feedback about how is it going.
That's a great idea, and what we're doing right now is flu shots. And that's what we're calling folks about, is flu shots. Yeah.
And
But we're with you.
I was shocked, I got a phone call.
You did, oh thank God, Shirley, we got some. There we go.
We actually do cooperate with the,
I am so happy we got you, and I didn't even know I was gonna put you on my list, and you were gonna get that call. I'm happy we got
We're
you.
trying to go get the shot right now.
yeah. Anybody who doesn't have one, it's like, I can do from here. Yeah, we can do a blow gun. We do collaborate with the health department once a year. The school physicals are usually towards the end of the school year so that they catch the track season too. And we usually do them for St. Regis, Alberton, and Superior. A few nights we'll stay until 9, 10 o'clock at night and get all the kids done. So that's a service we do put.
how's the clinic in St. Regis?
You really want me to talk about all this right now, don't you?
No, is
In
it
the West End.
what you thought? Is it still being?
Again, we're unwrapping everything, and I'm just going to tell you that in a county of 4,000, it's very unique to have so many spots of service. I don't know if we can keep doing that at that rate. Financially, it seems like what we've done is spread ourselves thin.